I want to add my thanks to the Alumnae family for giving me the opportunity to be here. When somebody asked me today, well, how did you get here? I said, because the same reason everybody else can never say no to Jeanne Fox. So you just say, yes, I'm going to do it, and then you just throw it up to God, because it's just easier than saying no to Jeanne Fox. I'm going to talk tonight about three things. I'm going to tell you a little bit about the hospital. This is my public service announcement, so hopefully you will never need the services, but if you do, at least you'll know who we are and what we do. Two, I'm going to talk to you about the things that I see changing in healthcare and how they may manifest themselves. And then lastly, I'm going to talk to you about why some of the attributes that I see for women leaders and why I think women leaders are uniquely positioned to play a major role in the future of healthcare, even more so than they have done to date. So you've already heard that Children's Specialized Hospital is the largest pediatric rehabilitation hospital in the country. So what does that mean? That means that if you are a child who was born with a developmental disability, or you suffered a traumatic brain injury or spinal cord injury, or have been born premature, you would come to us for services. The blessing is that there aren't that many children who are this sick that need that service, but if you are, then you want to make sure you get to us. We have the privilege of treating, and all of these pictures are pictures of our kids. That's one of my things. I don't use stock photos. You gotta be able to see the real kids who are being treated. So all of these kids on the inpatient unit, which is located in New Brunswick. We moved to New Brunswick in '07. We've been in existence for 123 years. We were the polio hospital in the 40s. Our original location was in Mountainside on New Providence Road, and many people say, we rode by that place all the time. We had no idea what you did there. And we provide services from the bottom of the state to the top of the state. And the thing that makes us so uniquely different is our partnership with families. Right? This is not just about caring for kids and sending them home. We have a lifelong commitment to them and their families to support them, to meet them where they are in being able to help them care and love their children. Over dinner, I was sharing that one of the hardest things I think for families are families who have children that suffer traumatic brain injury. Usually it happens through a car accident or one of those unforeseen things you couldn't imagine, going to the shore and diving into a sandbar or one of those types of incidents. And often families will, especially when their child is an adolescent and that happens, they long to have that child back that they had. And families who struggle with that, what I see is it totally impedes the healing of their child, because they never can let go of that child they had before. And so sometime during this process, if I'm fortunate enough, I have an opportunity to usually talk to mom or dad, doesn't matter. And I remind them that regardless of what they believe in, whether it's God or Allah or whomever, during this God-forsaken process that they prayed, that my child would live. And the good news is that their child lived. And now it is our responsibility at Children's Specialized to figure out how to help them live with this child that they have been blessed with. And that is often a very, very difficult path, and requires our employees to really immerse themselves into that family's life to help them find a way. And when I say employees, this is not just nurses, doctors. If you work in environmental services at Children's Specialized, you have an obligation to make sure you've got eyes on that family and you are wrapping yourself around them. If you work in dietary, equally important. Because often those are the times that parents will let their hair down, right? When they're in the cafeteria and they don't think anybody's watching. When that environmental services person is coming to empty the trash and that child is at therapy, that's when you'll see the real pain. And so it's on each of us, it's our obligation as a Children's Specialized employee to make sure we never, ever lose sight of that. And so how do we do that? We do that where we have the hubris, if you will, to believe that we are going to create a world where every child can reach their maximum potential. That doesn't mean that every child is going to walk out of that facility and run and jump and skip and do everything else. It means that we are going to make sure that we see success and help that child define success. For some of those children that live in one of our 2 nursing homes, it means that they might react to a sensation. Right? They might be able to blink their eyes. We're fortunate tonight to have Dr. Weijing and Dr. Morton here, who are working on some of the most incredible research in the world in helping spinal cord injured people hopefully be able to reuse their limbs. And when we get to work with experts like that, we never lose hope of what's possible, because they let us dream in their space. And it is so important to not limit yourself by what you see in front of you. It would be so easy to take every story of every child we have and just be devastated every day, thinking of what their life was going to be. But when you start from the perspective that every child is going to reach their maximum potential, you can't do that. You need to understand that your role in this journey is making sure that they get there. And the way that you get there is being the best of the best. We use the word preeminent. We're having a lot of discussions about it. People can't spell it, nobody knows what it means, and so it's probably coming out in a mission statement soon. But what I say to staff is, it's about being your best. It's about showing up every single day and giving everything that you can to help that child reach their maximum potential. That doesn't mean you're always going to have success, but it means you're going to show up and give your full to be there in whatever you do. Again, not whether you're the CEO, but whether you're in the dietary staff, whether you're in the environmental services staff, especially now. You know, those folks in housekeeping are literally making sure that our children don't get viruses that could kill them. Their role is just as important as my role. And making sure we each come every day and understand that is critically important. These are all the long list of services that we offer through our 13 sites throughout the state. In 2001, we operated in 4 locations, and today we operate in 13, I think that's the right number. Our latest site we opened in Warren Township in Somerset County, and our focus is to be able to do the acute care in New Brunswick, means that high-end stuff, and then be able to send those children home so they can be able to get their care closer to the home. So their therapy services, whether it's speech or physical therapy, or occupational therapy, or psychology services, that way they can do that in close proximity to their own community and their own home. So let's talk about the future of healthcare. The notion that change is coming in healthcare cannot be ever imagined in how quickly it is going to happen. And it's going to change in every way. It's going to change in how we deliver care. It's going to change in what we expect from healthcare. It's going to change in how we pay for healthcare. It's going to change in every single thing. And the way that I start to think about this is when I think about cell phones, right? The first cell phone I ever saw, I actually can remember it vividly. I was in the Florio administration, and we had 3 of them, right? And so if you were lucky enough to travel with the governor, you got to see the cell phone. You didn't get to use it, you got to see it. And it was in a shoebox, okay? And it was heavy, and it was a black bag that carried around, and it really did look like that from Bruce Wayne in, it could be MASH too, but I was thinking Bruce Wayne in Batman, right? You open the lid and this big thing comes out and it talks in the phone. Right, that's your first cell phone. That's your visualization of cell phone. And you couldn't imagine, a cell phone, that only special people would have cell phones, right? Only governors would have cell phones. Today, if I left my cell phone, my mother thinks that my car doesn't start unless I have my cell phone in my hand, right? I am so obsessed with that stupid little cell phone, right? I would turn around if I forgot. I couldn't get through the day without a cell phone. That type of technology is what's going to happen in healthcare. In healthcare, we have built the entire system from the 60s forward, right? When Medicare came on and we started paying people based upon how often they saw people, we built an entire healthcare system around what was convenient for doctors and nurses. Now, I'm not saying that doctors and nurses don't work 24/7 and in hospitals and staff all those things, but in private practice, in the specialty clinics, when do you go to the doctor? When it's convenient for them between 9 and 5, right? We set up, and and I know, and we all know, if we've ever been to a hospital, it's a whole lot different on Saturday and Sunday. Forget Christmas Eve, right? Than it is Monday through Friday. And it's a whole lot different at 9 o'clock at night than it is at 9 o'clock in the morning. This technology piece is going to start to change this equation significantly. What we expect from our physicians, what we expect from our healthcare providers, how we're going to get information, how we want diagnosis, every piece of it's going to change for the same reason that the rest of the world has changed. Now, my parents are both here tonight. I am blessed that they are here and happy and well, but I'm going to talk about them because I talk about them during every speech. They don't usually hear it, so now I have to fess up at what I usually do, right? So I'm an only, so that brings a whole different escalation to the relationship between the mother-daughter, father-daughter. So my father, and I love him more than life itself. When my father heard that we were going to have to pay for television, this was an absolute, there was no freaking way we were paying for television. His TV had 13 stations on it. It had a little bit of tinfoil on the top. We could move things in and out. There was no reason we were going to pay for television, right? Now, Daddy doesn't know what we pay for television, thank goodness a day. But, you know, we now pay over $200 for television and internet in the house. And guess what? We still watch the same 13 stations, right? But you don't think twice about paying for television, right? This is what's going to happen in healthcare. When you have access to all this assortment of things, just like this type of technology, when you can go on and talk to a physician in all sorts of ways, you are not going to care whether your insurance covers it or not. Right now, we get all kooky in the head, right? Mommy spends hours on the phone with those people from Medicare, right? They know her personally. They are not going to care when all of a sudden your little phone can look at that hole and tell you whether or not it's cancerous. Can take that x-ray and you can send it to somebody and see whether something is broken or not. When you have the access to be able to put a pulse ox, which is a little piece that you tie to a, help me Dr. Wise, to a cardiac monitor to be able to show what your blood pressure is and see whether you're not in trouble, all of that is going to happen when you're in your PJs, right? And that type of change and that type of access is going to revolutionize what we expect from medicine and how we think about it. Now, I'm not saying that it's right or wrong. I'm not advocating one or the other. I'm just telling you the change is going to come so fast and furious, we're not even going to know what it is. And we're going to imagine, we're not going to be able to imagine, that we sat for hours waiting for our doctor to come, right? How long do you wait for the doctor to come, Daddy? Hour, 2 he's the most patient soul in the world. I don't wait for 20 minutes for anything. Nothing, right? The notion that you're going to wait, it's just not going to be, because you're going to have options at your ready. Just like you can Google, you're going to have options at your ready in ways that you never imagined you could. So up here is something we call a Vigo. This is a robot that we send home with our babies who are on ventilators. This robot allows us to have eyes on that baby for the first 2 weeks of their home stay. So remember, this child has been born premature. They've probably stayed 6-8 weeks in the pediatric intensive care unit. Then they come to us at Children's Specialized. They probably spend another 30 to 60 days with us. Our goal is to try and get them as strong as possible and wean them off the ventilator. Most of the time with these type of kids, they're so compromised they can't be weaned. So we want to make sure that we have eyes on. So our doctor, Dr. Sharon Burke, who is the blonde up in the top, literally is talking live to this family here in Irvington, and she can see them and be able to talk with the home health nurse there to see how's it going, talk them through it. And the reason that we're doing this is because in those first 2 weeks, mom and dad are scared to death. So every time the baby looks a little cross-eyed, you know what happens? They go to the ED. And you know what happens when you go to the ED? Well, this is a baby on a ventilator. You immediately put them in a PICU because you don't want anything to do with them because something could go south, and so they got a 4 or 5 day hospital visit. Think about, again, how that disrupts the entire family structure. Whereas if they know that they can talk to Dr. Burke at any time, but if we schedule a time so they know what's going to happen in case they don't call us, think about how much better it is. And in this situation, which was so dramatic, it was our second visit. So Dr. Burke was talking to them, and the technology is so sensitive that she heard something. Now the home health nurse is there, and mom and dad are there, and they're so excited about, they're looking at her on the robot, and they can see her face, and so they're talking about all these things, but she hears something. And she says to the nurse, I want you to check that trach. And the nurse says, no, she's fine. She said, no, you need to check that trach. She could hear, because of how the baby was breathing, that the trach had popped out, right? So again, avoiding the ED visit, she talked her through how to do that. So she would have the courage to put that airway back in there, do the tie herself, which is what we expect of parents, by the way, when we send them home with very little nursing service from Medicaid. And she was able to do that. Think about how in that short moment of time, that entire family's life was changed for that last week. Avoided all that tumult, all that craziness, just by the use of technology. We all think about hospitals as the center of our communities, right? Often, if you take outside of government, hospitals are the largest employers in most communities. They are the mainstay. Those are where nonprofits go to have support, whether it's your local Y or in this city in New Brunswick tomorrow, they partner with the hospitals to be able to facilitate things. And every community had at least one. New Brunswick's always been blessed with 2 hospitals, and they were places that you turn to all the time. Now the experts tell us that if you are not part of a $3 billion, that's with a B, $3 billion hospital system that covers broad geography, you will not be able to survive. And you will not be able to survive because the demands are going to be so great for your investment in capital around technology to be able to manage populations of health that there's no way you can afford to do it alone. So in 1989, I get the year right now. In 1999, Children's Specialized joined the Robert Wood Johnson Health System. They joined the Robert Wood Johnson Health System because managed care literally would not contract with them to provide services for kids, and they were getting themselves blocked out. Now we, the board of directors at that time, defined a relationship that allowed Children's Specialized to continue to keep its name, maintain its own foundation, and really be assured of us being able to stand on our own, but other hospitals hadn't done that. Children's Seashore House in Atlantic City, as an example, which did similar things to us, was purchased by a very big children's hospital down in Philadelphia and was consumed within CHOP, and now its rehab component is very, very small. So there are trade-offs for all of that, all of those changes that will come. But every hospital in the state is trying to think about who do I position with to ensure my long-term viability. Not just for size and scope to compete with, to be able to negotiate with managed care, but really to have the access to capital to be able to do all of those investments that are needed. The next part of healthcare that's going to change is that you are going to be measured on something called value-based purchasing. So you're actually going to be measured on your quality. Think about how you go get your doctors today. Anyone take a guess? Referral, but from whom? Absolutely, right? My mother spends more time looking at consumer reports to buy her car than we spend on looking for our doctors, right? You call me, you call somebody you know in healthcare, and they say, give me a guy, you know a guy? Oh no, consumer reports gives us four stars, we see what the reliability is, we know what the relationship is. Now this is changing, health grades and other things are starting to do those things, but quite frankly, there are so many of them, nobody knows how to discern them. Everybody's a top hospital, everybody gets a gold star, you can't judge whether it's good or it's bad. And look, I know I compete all the time to try and get all those awards, because I just want to make sure I have one more award than the other guy, right? But does anybody really look at them? No, when their kid is sick, they pick up the phone and they call me and say, what can you do for me? To be able to give people objective information, to be able to make those decisions. And you know what? Since we've been asking you to do this for 20 years and you haven't done it, this is what we're going to do. We are now going to pay you based upon whether or not you meet these metrics. Now there's lots of debate within the healthcare community about whether the metrics mean anything or don't mean anything. The people who are doing really well think they mean something. The people who don't say that they're lousy. I don't know what's true or not true. It doesn't really matter. At the end of the day, here's what I know. The only reason you're going to get what you're getting today is if you can meet those minimum metrics. They're not going to pay you anymore. You're just going to keep getting what you're getting today. And if you don't, they're going to find you. And they're going to find you big. And this is coming fast and furious, right? People are dabbling in it now. We're rolling these things out slowly. Medicare is going to start. Remember, you care for your elderly, aged, or poor. So Medicare is going to be the one that starts that progression, but you're going to see employers and governments and other entities beginning that progress around this quality. I don't know what it's going to do in reference to patients. In Pennsylvania in the 1990s, they set up a commission on healthcare quality, and they spent probably $20 million collecting all of this data, and they issued these reports that showed where the quality was based upon their metrics. And you know what happened to people's behavior? Nothing. Absolutely nothing. All of it was published, all of it was sent out, they sent all these big documents out, nobody's behavior changed, not one iota. Now, I ask you to keep that in mind for the further part of the conversation. Right now, you all know that the Accountable Care Act that Congress passed and the President signed provides opportunities for those people who are uninsured to be able to go to what's called a health exchange and buy an insurance plan. And depending on how much money you make, that will either be a subsidized plan or not. So everybody's watching this activity going on, right? And I'll show you some numbers later about how many people that are enrolled. But here's the other side of that story. While all of this is going on, it's sort of like the Ponzi scheme, right? Look over here, will I go over there? So while all of this is going on over here, the federal government, everybody thinks it's just for the uninsured, employers are saying, this healthcare stuff is really a drag. I provide all this, spend all this money to provide health insurance for my employees, and nobody's ever happy, right? It always costs too much, the choices aren't the right ones, I picked the wrong benefit plan. So what happens is brokers who sell insurance are smart. They see this exchange thing going on over here, and they say, hey, we can set up private exchanges for companies. And we can make lots and lots of offers for those private exchanges so they'll be able to provide their employees with big opportunities. So on these private exchanges, they can set up Walgreens and Sears and Petco have already done it. And so they give their employees maybe 10, 20 different plans to pick from. And they say to their employees, here's $10,000. You go knock yourself out. Buy whatever plan you want. You want to pay up, you want to have the gold plan, you want to have the small plan, whatever it is, you pick it. I'm out of this business of health insurance. You do it. So for somebody like me, at Children Specialized, who the parents, if they don't have the right plan, their kid is not going to get access to services, this is frightening. Absolutely frightening. Because people, when they think it's their money, and it's always their money, but when they actually are the purchaser, we don't know what they're going to do yet, but our fear is they're going to buy the cheapest plan. So we all know how complicated health insurance is, right? We've all had to manage it for a family member, let alone ourselves. So how do you know what questions to ask? How do you make sure that you've got those questions at the forefront, especially when your child's life depends on making sure that they have the right plan? Now, we've just rolled out this toolbox for parents to be able to use, but this is a huge issue, and people believe that 50% of all the people who work for private businesses by 2019 will be in some form of private exchange. So this is, again, fast, furious, okay? The other change in healthcare that's coming is the impact of our obesity epidemic. I am going to spend way too much time talking about this tonight, but it is really, really critical. As we look at the number of children who are now finding themselves faced with the reality that they are morbidly obese. They have type 2 diabetes, the type of diabetes that you get from obesity, not from being born with, but acquiring. And this is absolutely one of the most critical issues facing our time. And why is it critical? Because depending on the stats that you look at, not only does obesity account for 300,000 deaths, and we spend $100 billion on obesity-related illness. When you look at the stats, that if both parents are obese, their child has an 80% chance of being obese, right? And if you look at the next slide that I'm going to talk to you about, that when surveyed, children who are obese are asked about their quality of life, their scores are actually lower than a child who's being treated with cancer, who's on chemotherapy, right? The emotional costs of these issues are things that we have not even begun to manage, let alone the reality that those children, let me get to my slide, those children will lose 5 to 20 years of their life. 300,000 people every single year die of issues and complications related to obesity. If we said to ourselves, and we accept it, right? We generally accept it, we don't think about it, we're not in the Ebola crisis over it, right? One person has died of Ebola. 300,000 people die of obesity every year. Do we see all of this crisis going on? Think about it from a plane crash perspective. I actually had some fun looking up these stats. 138 plane crashes happened across the world in 2013. 462 people died, okay? So if I take that 300,000 number and I do my word problem, that would equal 89,000 plane crashes. What do you think would happen if we had 89,000 plane crashes, right? We would be in a state of emergency. We would want every single person involved in what was going on that was letting this happen over and over and over again. But we accept it. We accept the fact that our children could be live 20 years fewer. We accept that this is just the way it is. And I'm not preaching this to try and be holier than thou. It's a struggle every day. I'm preaching this because it's something that I want to try and put a challenge out at the end of the speech as I think about what is possible for this next generation of women leaders. The CDC tells us that unfortunately, women have done a great job of breaking the glass ceiling in one area, and that's in poor health. Our cancer rates, our heart disease rates, our stroke rates, our Alzheimer's rates, our respiratory issues are all either equal to or surpass men. I don't think that's the place that we wanted to win. And most of these areas can be controlled. They can be controlled by your health, your stress, your exercise, and really doing something that is absolutely, totally abnormal for us. Taking care of yourself first. Dr. Weiser will correct me, but not publicly because he's not like that. But I believe the data tells us that 10% of your makeup comes from your genes. Not 50, not 90. You're right, Daddy, I didn't get the tall genes, I got the short genes. But in reference to illness, 10%. The other 90, we do to ourselves. And that stress component is just as big as all of these other components that go into it. People say there isn't enough money, right? People say that there is no way to be able to counter all this thing because there's just not enough money to care for everybody. And then I look at this. I look at $26.7 billion are spent each year in the United States on, I don't know if you can see this one up at the top, but this is the DY body wrap that shrinks the fat off you, okay? That's not covered by insurance. My Weight Watchers is not covered by insurance, although, you know, it's really a good app and I like using it. I'm totally hooked on this Fitbit craziness, right? I'm like, if I don't have my steps by the end of the night, I'm standing at my bed, stepping around like a crazy person, right? But we spend all this money on these quick fixes, on something that we think will make it better, a silver shot, right? Or one little silver bullet, instead of doing the hard work of day in, day out, taking care of ourselves. So I'm going to ask you to help me, because my point is, before you watch this from the president of Microsoft, if you say she's crazy on the technology, I want you to listen to what he said when they talked about the iPhone in 2005. We tested it, it was there, so I know.
Let me ask you about the iPhone and the Zoom, if I may. The Zoom was getting some traction, and Steve Jobs goes to Macworld and he pulls out this iPhone. What was your first reaction when you saw that?
$500 fully subsidized with a plan? I said, that is the most expensive phone in the world, and it doesn't appeal. So I kind of looked at that and I say, well, I like our strategy. I like it a lot.
How do you compete with that, though? He sucked out a lot of the spotlight in the last few weeks because of what happened at Macworld, not only with the iPhone, but with the new iPod. How do you compete with that, with the Zoom?
Right now, well, let's take phones first. Right now, we're selling millions and millions and millions of phones a year. Apple is selling 0 phones a year. In 6 months, they'll have the most expensive phone by far ever in the marketplace. And let's see, what's the expression? Let's see how the competition goes. In the case of music and entertainment players, Apple absolutely has a preeminent position. We said we want to be in this market. There's a lot of reasons why there's synergy with other things that we're doing. We think we've got some unique innovations, particularly what we're doing with community, with wireless networking. And we came into the market, a market which they are very strong. And we took, I think most estimates would say we took about 20-25% of the high end of the market. We weren't down at some of the lower price points, but for devices $249 and over, we took, let's say about 20% of the market. So I feel like we're in the game, we're driving our innovation hard, okay, we're not the incumbent. He's the incumbent in this game, but at the end of the day, he's going to have to keep up with an agenda that we're going to drive as well.
And you still feel like you can be very competitive in that space?
Sure, absolutely. If we didn't think there was transformation going on, we wouldn't be playing.
Hey, so how many people have a Zoom phone? Right? That was 8 years ago. Right? The entire marketplace changed in an 8-year window because of the technology, because of the activity, and I'm telling you that same type of change is going to happen in healthcare. And you are going to wonder why you ever scheduled on the phone. You're going to wonder why you have ever sat in an office and waited. You are going to wonder why all of those things happen. Just like I talked about that cell phone in the box, you're going to laugh about today in the very same way. So as we talk about women in leadership, you know, there are lots of different ways that you can be a woman in leadership, right? You know, Sheryl Sandberg has spent a lot of time talking about her Lean In book, talking about how women miss the opportunity to be present. And I have to tell you, when I read the book, I was a little annoyed. I'm thinking, really? Like, you were the assistant to the undersecretary of Treasury and you and I have anything in common? Are you kidding me? Not really. You went to Harvard? Like, really? With the silver spoon in your mouth, you're going to lecture me about leaning in? And then I stopped all the negativity and I read the book. And I read the book and it talked about walking into the room and sitting along the wall so everybody at the table would have a seat. Right? It talked about how you always deferred. Nobody told you to sit at the wall. Nobody told you to defer. But you did it. Because in some ways, those were the lessons that we thought we heard. And as women, there isn't a straight path, right? Let me tell you, I mean, I'm not proud of this, but I can cuss with the rest of them, right? Like, I can do the men one-to-one. I can stare them down, and I was Dr. No in the governor's office, right? No, that's the stupidest thing I've ever heard. No, you're not going to do that. No, we're not going to talk about that. That was my role, right? That's what I did every day. And it wasn't pretty, right? And it wasn't feminine. It wasn't any of those things, but I needed to get a job done. And for women, it is important that you find that comfort level for what works for you. So for Gloria Steinem, she had a certain role, right? She was going to go out there and she was going to push and she was going to be in your face and she was going to make sure you knew who she was. Nothing wrong with that. You know, when I look at Margaret Thatcher, she played a little different role, right? A little more reserved. She's going to make sure that she was the tough one at the table, but always in a very dignified way. Two strong women leaders, right? But very different styles, very different ways of approaching it. And they're both right. But they have to be right for you as a woman leader. And that really is the hard lesson to learn. So I created my top 10 list, okay? And this is a list that I worked on significantly, and I'm gonna talk to you about them. And for me, this has been my guide in reference to being able to help define what type of women leader I wanted to be. And the first one is never stop learning. You know, I really thought once you got to be called president, I didn't really care what you were president of. You know, you could be president of the treehouse. But once you were president, you were done, right? Feet up on the desk, you were good, you could order issues, people obey, and you don't really have to worry about it. I have worked so hard in these last 11 years, and I am nowhere on this journey, right? I have read every book I can read. I have tried as much as I can to be better every single day, and I never imagined that once you got to that kind of position, that it wouldn't all be easy, right? Because it really was about attaining the title, right? No, it's about earning the job. And the only way you earn the job is each and every single day. You show up with your full heart and you work harder than everybody else. And you never, ever, ever be afraid to get dirty, right? I will never be able to change a trach, thank God for the nurses in the room who know me, you know, but I can pick up garbage. I can move chairs. I can make sure that I lend a hand wherever I have the ability to do. And everybody in my organization knows that. The guys in environmental services get really annoyed about it, but they know it. One of the other things I will teach you, and I know I gotta have eye rolls about this, and I know my dear friend Susan is gonna give me the eye roll about this, learn how to play golf. Okay? Not because you like golf. Nobody likes golf, really. I mean, that's just not even true. But learn how to play golf because you will never get 4 hours with anybody in any meeting than you do on the golf course. So big donors, right? Whether it's you're trying to impress somebody in the office, never, ever, ever with anybody would you get that amount of time. So learn how to play golf. And here's the secret. If you don't learn how to play golf, you're going to be the one in the office when they're all out playing golf, and you're going to be so mad about it that you're not even going to be able to see straight. When you're the woman, you get to play from the red tees. The red tees mean you get probably, depending on the course, 20 or 30 feet ahead. So you learn how to drive the heck out of that ball, and then men will invite you back to play, because as long as you're playing a scramble, they will win. And all they care about is winning. They don't even like you. It doesn't really matter. but you get an advantage with those red tees, so just go ahead and do it. It really isn't that hard. Never, ever, ever, and this is so important in New Jersey, never burn a bridge, okay? I can't tell you how many times there are people that I would like to tell them I will never speak to them again for the rest of my life because they're such miserable human beings, and then they end up being governor or senator or some other thing, like you're never going to meet them again. So it is really important, no matter what you actually feel about them, shut up. Do not say it. Let them think that you are their best friend no matter where it is or when it is, and make sure you keep those relationships strong. Number 7, it is not about you. Women personalize everything, right? Absolutely everything. And you assume that when I don't make eye contact or I walk by, that you did something to me. It is not about you. Stop all that. When you show up and do your best every single day, going back to that previous slide, it doesn't matter. And if I have an issue with you, this is actually one of our values at Children's, I have an obligation to speak to you directly. And if I don't, it's on me. Because you know what happens when you don't deal with issues? I tell my staff this all the time. I'm walking down the hall. I see him turn right, I see him turn left. They'll do anything except actually spend time with me. That's not healthy. You've got a really hard job to do. Don't be carrying that stuff around in your belly. Get it out. Put it on a table. So many times I see women worried, absolutely tortured about the fact that, whether it's a work situation and somebody was not as polite as they should have been, or the guy didn't call, and what did you do? Stop already. Just stop. Those are hours of your life you will never get back. Just stop fretting about it. Number 6, have a really good friend. This is a person that is going to look you in the eye and say to you, you are being a jerk. Right? You cannot wear that dress anymore. That color does not work on you. Whatever it is, this is the person who you know, whether you are on the top of the moon or you are waiting tables at Marsilio's, they are going to love you in the same way. When I was 20, I thought the most important thing was to have as many friends as I could. Right? I wanted them alphabetized, I wanted a Dewey Decimal System, I wanted to be able to keep track of them however I could, because I thought that determined my worth. It doesn't. My father tells me all the time, if you have 3 or 4 people at the end of your life that you can count on, you are a rich person. Those relationships start now, wherever now is for you. And they need to be honest, and you need to hold them tight, and you need to work at them. Because they do go away if you don't actually invest in them. So make sure you have a really good friend. This one is one that you're going to roll your eyes at. And so I'm going to need you to stay with me on, because it's really, really important. You need to take care of yourself. You need to actually take the time to get both the care and love and attention you need. Yes, there are so many things that vie for your time. There are so many people in your life who you are responsible for. And if you have parents or you have children, they're calling on you, right? And if you have nieces or nephews or whatever it is, there's always somebody to consume that time. But here's what I know what happens. When you get sick, you make the time then. If you actually invest in the time now, it prevents that illness. Or at least it may help you heal a little bit better. But we never do this because we see it as selfish. Oh, I couldn't get up an hour early to go to the gym because my family would need me. Or I really need to be at that Mama Do lecture tonight because she may say something that's important. Yeah, okay, probably not. Probably you need to take care of yourself and make sure that you are listening to yourself. And here's the stuff I didn't do when I was young, right? I didn't actually get rid of all those bad noises in my head. You're not pretty enough, you're not smart enough, you're too fat, you don't run fast enough, right? All those things. So guess what happens? When you get to 50, they don't get any better. They just get louder. All right? Get the help you need now. Right? Especially now. You're at college. You've got this wonderful, incredible health system available to you at the health center. They can help you get to the assistance you need. Deal with it. It doesn't get any easier. And let me tell you, one divorce later, it's not like you actually work through it. Right? You bring it with you and you bring all of it to the table and it's just a mess. So deal with your stuff now and figure out a way to get through it and take care of yourself. Number 4, bad things are going to happen. They just are. It's life. The only thing you can control is how you react to those bad things. Right? And it is so important to stop the self-flagellation of the why me, what this happened, what did I do wrong. Stop. Just stop. You know, whether it's the worst of cancer or an accident, or whether it's the I didn't get the job I want, or I didn't get to go out with the guy I want, or the guy I want I shouldn't have wanted, like whatever it is, like bad things happen. So figure out your way to deal with them, and be able to manage them, and be able to still love yourself as you go through that. Number 3, be kind. This sounds so simple, right? This is motherhood and apple pie. But let me tell you, when that mom is screaming at me, yelling at my nurse and what she didn't do, it is really hard for me to find kind, okay? It is nice, it is easy to find kind when people are nice to you. It is really hard to find kind when people are being their worst. But what happens when you are kind to people in that situation, it's totally disarming. When you find ways to say, I'm sorry, even in the worst of circumstances, it dials everything down. Right? Everything. It just levels the playing field. And you know what happens with that kindness? You get it back. Maybe not that moment, but you will get it back every single time. Somebody said to me I was in the hospital yesterday and I was going to see 2 different patients and I had all this stuff going on and I was in that, Amy mode, like I'm going to knock you over if you don't get out of my way. And the woman answered one of my questions to tell me where a patient was. And I said, thank you so much. And she said, I hope you are blessed today. Right? I didn't know this woman. I still don't know her name. But it stopped me in my tracks. That she could see that this wasn't where it should be. And she knew I was going to see people that really needed it to be where it should be. And she took that moment. That kindness, that unbelievable kindness, makes such a difference in all of our lives. But especially if you're in that one right now where you need it, it really makes a difference. Believe in something bigger than yourself. I don't care if it's church, a synagogue, a temple. I don't care if it's the Dalai Lama. I don't even care if it's George Bush. Whatever it is, like if you think that that's your bigger than yourself, then go ahead and believe in it. It helps you center. It helps you understand that you are not alone in this world. It helps you get perspective. When I go to church every Sunday, sometimes I listen, sometimes I don't. Sometimes it's about being there and being part of a larger community. And it helps you remember how those random acts of kindness that we do as part of those larger communities make a huge difference in the world. Not just in your immediate community, but broader. And then lastly, most importantly, it is okay to be a girl. It is absolutely okay to wear the high heels and put the dress on and be all frilly when you want to be. And it is okay to always embrace your femininity. Nothing wrong with that. Actually, I love it when I'm the only girl in the room. A, because it makes people uncomfortable, and that's really cool sometimes too, right? But I bring a different perspective to the table. I see things differently. I hear differently. I listen differently. You're trained differently, right? Sometimes I'm the person that picks up the spills because nobody else pays attention to that stuff. But whatever it is, it's okay to embrace who you are. But it really means that you need to settle yourself and listen to who you are and own that. And it's worth the investment to do. So can you turn down the lights, Neil? Is there any way to just dim a little? Because it's actually worth the sight. I'm sorry, I should have asked you this before. If not, it's okay. So this is me in 1993 with Bill Waldman, who works in the school's social work, was the Commissioner of Human Services. But what's really exciting is that you can see me with this huge bad perm and all of this really bad hair. And so in 1992, 92, 93, I was fortunate enough to work for Governor Jim Florio in the Governor's Policy Office, as Jeannie said, and this was when I was at Human Services that next year as Deputy Commissioner. And at that point in time, as you were correct, I was in my mid-20s, late 20s, newly married, had this great job, life was just wonderful. And the governor said to me, actually the Chief of Staff, Joe Salinas, said to me, listen, the mayor of Cherry Hill is coming in to see us, and she's all worked up over this group home that's trying to go in her community. And you do this group home stuff, and you do these, take care of people with disabilities. So I need you to meet with her and be able to tell her about the law related to this group home. And she thinks that she's going to stop it, and we need to help her. I said, well, we can't help her. He said, well, what do you mean you can't help her? You got to help her. She's the mayor of Cherry Hill. She's a really big deal. She's one of the only female mayors. We love her. We help her. I said, oh, no, you can't help her. I said, the federal law is really clear. She cannot stop this group home from going in. It's a federal law. It's already been litigated. It's gone all the way up to the Supreme Court, blah, blah, blah. And they're like, well, no, you have to talk to her. So, what did you call me? A pisher or something? Yeah, some name that I know wasn't nice. She comes in to meet with me, and she is ready to fight, right? Because first of all, they're not meeting with her. They're sticking with some young kid who she's never met before, and I didn't have South Jersey credentials, which meant I was, I might as well be from I don't know where, at that point, didn't matter, the moon, didn't matter. So she comes in and she goes, Oxford House, blah, 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 and you have to stop it. And I said, well, Mayor, there's a federal law, and actually the then Congressman supported the federal law, and he voted for it 10 times, and the President signed it, and it says that you cannot discriminate against people with disabilities. And I go, and see, here's the chapter, and here's it. She looks at me, she goes, I don't think you heard me. You need to make this stop. And I now at this point realize I am way over my head, right? Like I am in so much trouble because the mayor who they wanted me to take care of is now yelling at me, right? Bad. There's no good that's going to come from this. So, but here's the thing. I was 25. I didn't know any better. I was totally idealistic, and I said, this is what the law is, and you can do what you want, but at the end of the day, you're going to lose. So she left furious, hated me, right? She might have had some respect for the fact I stood up to her, but she was not happy, right? So life goes forward. I'm in 1994, I'm actually in Pitt, New Jersey at that point, or 2000, yeah, 94, right? From 90, I don't remember what year it was, 98, I don't know, 4 years later, something like that. So all of a sudden I get this call. This is from Susan Bass-Levin, who says to me, I told you that you were wrong. The rabbi in the Cherry Hill community hired the gentleman that lived in the group home to kill his wife. Yeah, right. So I was right. She couldn't stop the group home from coming in. She went all the way up to the Supreme Court and lost, and then the guy killed her. Now, the truth of the matter is, it was not the guy's fault, it was the rabbi's fault for hiring him. He took advantage of somebody who was addicted, and he knew that he'd get him to do the wrong thing. But at that point in my life, I didn't think about the consequences. I was so idealistic. The only thing that mattered to me was giving people the rights that they were entitled to, regardless of whether or not there were other consequences, right? I'm not saying I was right, she was wrong, because I would never admit that, but the truth of the matter is that this is actually the wonderful moment for women at Douglas to step up, to stand up, to speak out on the things that you care about. I would love to convince you that the things you should care about are obesity and our children dying because of this dreaded disease. I would love you to take on one of the many healthcare, okay, I gotta show this. It's just too, oh no, can a little bit more? It's such a bad picture that I just have to share it. Man, no, it doesn't work, it's okay. I'll show it to you later. But you guys are at the forefront of this. You have the ability to believe, not to be stopped by all these numbers and what money can't happen or can't change behavior or how big food controls the world or any of those things. You believe from your whole hearts, just like I did. Now hopefully nobody will die when you take those things on. But the truth of the matter is if it does, that's okay too. Because even though that guy did the wrong thing, all those other people got to stand on their feet and live in the community and show people a healthy way to live. I believe women at this point in life are exactly the people we need at leadership. You are the chances to bring, I'm sorry. Yeah, it's better. It's still a bad haircut. But I believe that women are at the forefront right now of leading that conversation. I think the public is ready for that empathetic dialogue that talks about the control. I believe the focus on cost in our healthcare system and people having to pay out of pocket up front is going to drive behavioral changes. But what needs to happen is a system to support people in making those changes. And I believe women leaders have the collaboration and the focus to be those people to drive that change. And so my plea, if you'll take it, is that there is tremendous opportunity for you to love and believe and reach and stretch. And the world is at your disposal. Because things are so bad that we really need the opportunity for somebody to have hope again. Just like I did at 25. To have hope that the world could be different. To have hope that we could save our children and let them live the lives that they deserve. And most importantly, to invest in each other so that we can see progress and success in ways that we could not even imagine. A world where every child can reach their full potential. I don't think it's only the vision for children specialized. I think it's the vision for each of us. I thank you for giving me the chance to be with you tonight.